Palantir has been contracted to streamline NHS data management. NHS staff also push back despite contracts being signed. By the end of 2024, fewer than a quarter of England's 215 hospital trusts were actively using the NHS Federated Data Platform. But the NHS clearly needs structural updates. So, if we give the government the benefit of the doubt for a moment, which I know is hard to do, Jade Ruyu, what are the genuine pros of bringing Palantir into our data management?
I don't find it hard to give the government the benefit of the doubt on this because when we look at the NHS, which is such a beloved institution, we can see that it's really in desperate need of a data reform. And the way that the federated data platform, which is what Palantir is helping to build, is being framed is it allows people who need to access the data on the front line to get it immediately so that, for example, people who are in an ambulance with a patient, they can, at that point, plug data into the system and send it to the hospital they're going to. I bring that up as an example that really hit home for me. But it's sort of the balance between this kind of operational efficiency, which in many cases I anticipate can save many lives, versus democratic risk, because there are just so many concerns with how this platform, which I think many people agree is really necessary, that can pose a risk. And I think what my reporting has focused on, it's not clear to us what data is going into this system. And it's also not clear to us whether the government has come up with any safeguards.
But the issue there is trust, and trust is so important in healthcare. I was recently being treated at the NHS, and they asked me, would I be happy for my anonymized data to be available for research purposes? And I always want to say yes. I believe in science. I believe in research. I want to help the advancements of health. But I suddenly found myself actually very stressed out because I know Palantir is involved in that database. And I had to really toss up, am I prepared to do that? The thing is, if everyone pulls out, then health doesn't get anywhere. Research can't go anywhere. And so it feels as though the government is sort of gambling with trust in healthcare. And I'm not alone. Polling shows that if UK citizens actually knew what was happening to their NHS data, half of them would opt out. And I think the main reason for this is, as you say, Palantir has this reputation of being comically evil. That's because of ICE, I think. And ICE has actually used healthcare data to track and deport and detain people. So many companies are therefore keeping Palantir out of their databases. Switzerland, which Palantir has also attempted to penetrate, has had at least 9 federal agencies refuse or decline Palantir products over 7 years. Britain has gone in precisely the opposite direction. And now we're being warned by campaigners from MedAct, the Good Law Project, Privacy International, that Palantir's presence could actually enable US-style ICE raids. Jasleen, is that a realistic fear, or is that fear-mongering?
I don't think it's fear-mongering at all. And another area where we saw this sort of idea of the government collecting all of our data sets was with the digital ID. If you remember, that had a massive backlash amongst the public. Almost 3 million people signed a petition saying, we don't want this in our systems. And that's because what the digital ID would have done is, like Jade was mentioning, is connect different arms of government up on your record. So that means potentially that you could end up in a situation where the government as a whole has access to an individual's health records and police records and education records and welfare records and tax records all at once. And so you end up in a situation where you have an incredibly comprehensive picture of an individual's life, which takes the power away from you and transfers it over to the government. And as we've been speaking about, where AI then is added on top of those data sets, and you can derive insights about people, you end up in a sort of, instead of a surveillance capitalism model, a state surveillance capitalism model, in the where the same way that Facebook takes your data and mines it for insights to sell it back to you, the government could take your data, mine it for insights, and use it to make decisions about your life. For example, which communities get more surveillance, whether you as an individual need an intervention when it comes to your child's schooling. Very quickly, you can see the ways in which your data can be used against you if you don't understand where it's going and who has access to it. And that's the sort of problem with, as we've been talking about, these aggregated data sets that have very little transparency and we have very little control over, despite them being our data.
What I would add to that is that in the UK, this database, the federated data platform, is coming at what some might see as an excellent time for reform, who have said that they want to create some kind of immigration surveillance system. And the UK CEO of Palantir has said that they will go forward with whatever an incoming party says. So I think that the writing really is on the wall in that way. I mean, the intent has been spoken.